Welcome, dear friends. Today we are going to learn about basic principle of cell injury. Cell is the basic unit of life. Diseases occur due to abnormalities at the level of the cell. So we can say when there occurs cellular functional or structural abnormality at that time, it results into a particular type of disease. To understand a disease, study of abnormalities in structure and function of the cells is important. Cell injury occurs when there is loss of cellular function leading to disease. Cell injury is defined as the effect of a variety of stresses due to etiological factors a cell encounters as a result of changes in its internal and external environment. Suppose this is a cell, this is an external factor. The cell, it undergoes some changes and the cell, it gets degraded. The the cell injury depends on the type of the cell and the tissue involved and extent and type of the cell injury. Now we'll take a look towards the type of cellular responses. Whenever your cell, okay, it undergoes some type of injury or an external factors and it is going to act on the cell at that time, how the cell is going to respond, that types we are going to see. There are three types basically. The first one is the cellular adaptation, second is reversible and irreversible cell injury, and third is subcellular changes or intracellular accumulation. Cellular adaptations. Now what is cellular adaptation? Whenever there is cell injury, there is increased functional demand, and to satisfy this functional demand, cell adapt to changes morphologically, and after the removal of the stress, the cell reverts back to its normal state. Okay, so that this occurs in adaptation. Now the second category is reversible and irreversible cell injury. This is the cell, this is the normal cell. When the cell, it experiences stress, it might undergo adaptation, and if the cell fails to adapt, then there occurs cell injury. Now if the injury is mild, the cell, it undergoes reversible cell injury and it's get reverted back to its normal cell once the mild stimulus is removed. If the cell experiences severe progressive injury, the cell, it undergoes irreversible cell injury and ultimately cell death. The cell death can occur by two processes. The first one is the necrosis and the second one is the apoptosis. Whenever the cell, it undergoes mild to moderate stress, it can recover. Okay, so this type of injury is said to be reversible cell injury. When the cell, it undergoes persistent severe stress, at that time it leads to cell death, and this is called as irreversible cell injury. The third change is that the third response is subcellular changes or intracellular accumulations. The residual effect of reversible cell injury may persist in the cell as evidence of cell injury at subcellular level, that is subcellular changes, or metabolites may accumulate within the cell. This is called as intracellular accumulations. Now let's take a look towards the etiology of cell injury. Etiology means cause. Etiology of cell injury is divided into two types. The first one is genetic cause. The genetic causes involves developmental defects, cytogenetic defects, single gene defect, multifactorial inheritance disorder. The second type of cause is called as acquired cause. It involves hypoxia and ischemia, physical agents, chemical agents and drugs, microbial agents, immunological agents, nutritional derangements, aging, psychogenic diseases, iatrogenic factors, and idiopathic diseases. Now let's take a look towards all these causes one by one. First is hypoxia. Hypoxia means deficiency in the amount of oxygen reaching the tissues. It can occur due to reduced blood supply to the cells due to interruption, that is ischemia, or it can occur due to impaired blood supply from causes other than interruptions, which includes disorders of oxygen carrying RBCs, mainly anemia and carbon monoxide poisoning. The second cause is physical agents. Physical agents in causation of disease are as under The first is mechanical trauma, which mostly includes the road accidents or a small cut or a small injury during playing or during working. The second is thermal trauma, example by excessive heat or by excessive cold. Thirdly, it can occur due to electrical shocks. Fourthly, it can occur due to radiations, mostly involving UV rays, ionization radiations. And it can also occur due to rapid changes in the atmospheric pressure. The third cause is the chemicals and the drugs. A number of chemical agents and drugs may cause cell injury. Important examples include the following. The first is chemical poisons, mostly the cyanide, arsenic, mercury, strong acids and alkalis, environmental pollutants, insecticides and pesticides. Oxygen at high concentration is also poisonous. Hypertonic glucose and salt solutions, social agents such as alcohol and narcotic drugs, and therapeutic administration of drugs can cause cell injury. Next causes the microbial agents. Injuries by microbes include infections caused by bacteria, by rickettsia, by viruses, by fungi, by protozoa, metazoa, and other parasites. Immunological agents also are responsible for causing cell injury. Immunity, we can say, is a double edged sword. It protects the host against various injurious agents, but it may also turn lethal and cause cell injury like hypersensitivity reactions, anaphylactic reactions, and autoimmune diseases. The next cause is the nutritional derangement. A deficiency or an excess of nutrients may result in nutritional imbalances. Nutritional deficiency diseases may be due to overall deficiency of nutrients, example, starvation, or it can be due to deficiency of protein calorie, mostly called as marasmus and kwashiorkor, or it can be due to deficiency of minerals causing anemia or deficiency of trace elements. Nutritional excess is a problem of an affluent society resulting in obesity, and obesity in turn might result into atherosclerosis, heart diseases, and hypertension. The next cause is aging. Cellular aging or senescence, which is called as loss of a cell's power of division and growth, leads to impaired ability of the cells to undergo replication and repair, and ultimately it leads to the death of the cell, culminating in death of an individual. The next cause is psychogenic diseases. There are no specific biochemical or morphological changes in commonly acquired mental diseases due to mental stress, strain, anxiety, overwork, and frustration, which mostly includes depression, schizophrenia. However, problems of drug addiction, alcoholism, and smoking result in various organic diseases such as liver chronic bronchitis, lung cancer, peptic ulcers, hypertension, ischemia or ischemic heart diseases, etc. So, to avoid cell injury, we have to avoid this substances, intake of such substances. The next cause is iatrogenic cause. Although, as per Hippocratic oath, every physician is bound not to do or administer anything that will cause harm to the patient. But there are some diseases as well as deaths attributed to iatrogenic causes, means due to medical the death caused due to medical examination or treatment. Examples include occurrence of disease or death due to error in judgment by the physician and untoward effect of administered therapy, mostly the drugs and radiation. The next cause is idiopathic diseases. Idiopathic means unknown cause. Finally, although so much is known about the etiology of diseases, there still remain many diseases for which exact cause is undetermined. For example, most common form of hypertension which consist for 90% of the cases, is idiopathic or essential hypertension. Similarly, exact etiology of many cancers is still incompletely known. So, this was all about the etiology of cell injury. Thank you for watching.